Understanding trauma definition, causes, types, effects, and interventions. Hello everyone, and welcome back to Hwyet Media, where healing and growth begin with understanding. In today's session, we're diving deep into one of the most sensitive yet important mental health topics, trauma. This is not just another discussion, it's an invitation to understand what trauma really is, how it affects the mind and body, and most importantly, how healing can begin. Whether you are a survivor, a caregiver, or someone supporting others in difficult times, this video is for you. Trauma dosing. Tea always look the same for everyone. It can come from a single event or from repeated exposure to painful experiences. But no matter how it starts, trauma leaves a mark on how we think, feel, and interact with the world around us. So, in today's video, we will explore the definition of trauma, its causes, types, effects, and the most effective interventions for recovery and resilience. Let's begin with a simple yet powerful question. What is trauma? According to the American Psychological Association, APA, trauma is defined as an emotional response to a terrible event such as an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Long-term reactions may include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. In simpler terms, trauma is the mind and body's way of responding to an overwhelming experience that exceeds our ability to cope. It shakes our sense of safety and changes how we perceive ourselves and the world. Trauma doesn't just live in memories, it lives in the body, in emotions, and even in behavior patterns. It's important to understand that not everyone reacts the same way to traumatic experiences. Two people may face the same event, say a car accident, and while one might recover quickly, the other may struggle with anxiety or nightmares for years. This difference depends on individual resilience, past experiences, social support, and biological factors. Causes of trauma. So, what causes trauma? Trauma can stem from a wide range of experiences, both sudden events and chronic situations. 1. Acute events like accidents, natural disasters, or acts of violence can trigger immediate trauma. 2. Chronic exposure to distressing circumstances such as domestic violence, war, bullying, poverty, or long-term neglect can lead to deep, lasting trauma. 3. Developmental trauma occurs in childhood when a child grows up in an environment that lacks safety, love, or stability. Other causes include sexual abuse, emotional manipulation, medical trauma, forced displacement, war and conflict, loss of loved ones, or witnessing violence. Refugees and displaced people, for instance, often experience trauma not just from war, but from separation, loss of identity, and the constant uncertainty of survival. It's also worth noting that trauma can be vicarious, meaning people can experience trauma indirectly by witnessing or hearing about someone else's suffering, such as caregivers, therapists, journalists, or aid workers in conflict zones. Types of trauma. Now, let's discuss the different types of trauma. Understanding the types helps us identify the right kind of support and intervention. 1. Acute trauma results from a single distressing event, like a car crash or assault. It often causes shock, confusion, or intense fear immediately after the incident. 2. Chronic trauma develops after repeated and prolonged exposure to stressful events such as domestic violence, abuse, or long-term illness. It gradually erodes one's sense of security and 3. Complex trauma occurs when multiple traumatic events, often of an interpersonal nature, take place over time, such as childhood neglect combined with violence or displacement. 4. Secondary or vicarious trauma affects individuals who witness or work closely with victims of trauma. For example, counselors, nurses, or humanitarian workers may develop symptoms similar to those of their clients. 5. Transgenerational trauma. This is trauma passed down from one generation to the next. Children of war survivors, refugees, or those who grew up in conflict environments may experience emotional and psychological distress without directly experiencing the original trauma. Effects of trauma. Trauma can have far-reaching effects: emotional, psychological, physical, social, and even spiritual. 1. Psychological effects. Trauma can lead to anxiety, depression, guilt, fear, low self-esteem, emotional numbness, and a loss of trust. It can also contribute to mental health disorders, such as post-traumatic stress disorder, PTSD, which involves flashbacks, nightmares, and hypervigilance. 2. Cognitive effects. Many trauma survivors struggle with concentration, memory problems, intrusive thoughts, and difficulty making decisions. They may replay the event over and over or have distorted beliefs about themselves, such as "I am not safe" or "it was my fault." 3. Emotional effects. Emotions after trauma can swing between anger, sadness, fear, guilt, and shame. Survivors may feel detached or emotionally numb as a defense mechanism. 4. Physical effects. Trauma doesn't only affect the mind, it also affects the body. Physical symptoms can include fatigue, headaches, sleep disturbances, stomach problems, muscle tension, or chronic pain. Research has shown that trauma changes brain structures related to stress and emotional regulation. 5. Social and relational effects. Trauma can damage relationships and social trust. Survivors may isolate themselves, struggle to connect emotionally, or find it hard to communicate. Family conflict, divorce, or loss of friendships often follow untreated trauma. 6. Spiritual effects. Many people begin to question their faith or life's meaning after trauma. Others, however, may experience spiritual growth and resilience by finding hope and purpose in adversity. 5. Interventions and healing strategies. Now, let's turn to the most hopeful part: interventions and healing. Healing from trauma takes time, compassion, and support. There's no one-size-fits-all approach, but several proven strategies can promote recovery. 1. Psychotherapy. Professional counseling helps individuals process and reframe their experiences. A cognitive behavioral therapy (CBT) focuses on changing negative thought patterns. B. Trauma-focused therapy and EMDR eye movement, desensitization and reprocessing are highly effective for PTSD. C. Group therapy allows survivors to share experiences and learn from others in a safe space. 2. Medication. In some cases, psychiatrists may prescribe antidepressants or anti-anxiety medications to manage symptoms while therapy is ongoing. 3. Support systems. Social support plays a huge role in healing. Family, friends, and community networks provide emotional safety and understanding. Listening without judgment can make a tremendous difference. For self-care practices, healing also involves personal routines that restore calm and balance, like regular exercise, journaling, deep breathing, meditation, prayer, and healthy nutrition. Avoiding alcohol or drug use is crucial, as these can worsen emotional distress. 5. Education and awareness. Understanding trauma is part of recovery. Knowing that symptoms are normal reactions to abnormal events helps survivors stop blaming themselves and start focusing on healing. 6. Spiritual and cultural healing. For many people, cultural traditions, community rituals, and faith practices are powerful sources of comfort and resilience. 7. Community and advocacy work. Communities can create trauma-informed environments in schools, churches, workplaces, and refugee programs where individuals feel safe, respected, and supported. In summary, trauma is not just about what happens to us. It's also about how we respond and what support we receive afterward. While trauma can deeply wound the human spirit, healing is always possible with compassion, understanding, and the right interventions. People can rebuild their sense of safety, reconnect with others, and rediscover hope. If you or someone you know is struggling with the effects of trauma, please seek professional help or reach out to a trusted person. Remember, you don't have to face it alone. Thank you for watching Hwyet Media. If you found this video meaningful, please like, share, and subscribe for more educational discussions on mental well-being and healing. In our next episode, we'll focus on post-traumatic stress disorder, PTSD, how it develops, its symptoms, and effective treatment options. Stay strong, stay hopeful, and remember, healing begins with understanding.